What are the effective ways to manage your anxiety? It is completely normal to worry when things get hectic and complicated. But if worries become overwhelming, you may feel that they are running your life. If you spend an excessive amount of time feeling worried or nervous, or you have difficulty sleeping because of your anxiety, pay attention to your thoughts and feelings. They may be symptoms of an anxiety problem or disorder. Anxiety is a natural human reaction that involves mind and body. It serves an important basic survival function. Anxiety is an alarm system that is activated whenever a person perceives danger or threat. Everyone experiences feelings of anxiety from time to time. Anxiety can be described as a sense of uneasiness, nervousness, worry, fear, or dread of what's about to happen or what might happen, trouble, or threat. While fear is the emotion we feel in the presence of threat, anxiety is a sense of anticipated danger. Feelings of anxiety can be mild or intense or anywhere in between. Depending on the person and the situation, mild anxiety can feel like a sense of uneasiness or nervousness. More intense anxiety can feel like fear, dread, or panic. Worrying and feelings of tension and stress are forms of anxiety. So are stage fright and the shyness that can come with meeting new people. Facing an important test exam, a big event or performance, or a major class presentation can trigger normal anxiety. Although these situations do not actually threaten a person's safety, they can cause someone to feel threatened by potential embarrassment, worry about making a mistake, fitting in, stumbling over words, being accepted or rejected, or losing pride. Now, because anxiety makes a person alert, focused, and ready to head off potential problems, a little anxiety can help us do our best in situations that involve performance. But anxiety that's too strong can interfere with doing our best. Too much anxiety can cause people to feel overwhelmed, tongue-tied, or unable to do what they need to do. Now, what causes anxiety and anxiety disorders, which can be complicated? It's like that a combination of factors, including genetics and environmental reasons, which play a big role. However, it's clear that some events, emotions, or experiences may cause symptoms of anxiety to begin or may make them worse, and these elements are called triggers. Anxiety triggers can be different for each person, but many triggers are common among people with these conditions. Most people find they have multiple triggers, but for some people, anxiety attacks can be triggered for no reason at all. For that reason, it is important to discover any anxiety triggers that you may have. Identifying your triggers is an important step in managing them. So, what are some common anxiety triggers? Here are few of them. First is the health issues. A health diagnosis that's upsetting or difficult, such as cancer or a chronic illness, may trigger anxiety or make it worse. This type of trigger is very powerful because of the immediate and personal feelings it produces. Medications. Certain medications and over-the-counter drugs can trigger symptoms of anxiety. That's because active ingredients in this medication may make you feel uneasy or unwell. These feelings can set off a series of events in your mind and body that may lead to additional symptoms of anxiety. Medicines that may trigger Anxiety include birth control pills, cough and congestion, medications for weight loss, and etc. Caffeine. Number 3. Many people rely on their morning cup of joe to wake up, but it might actually trigger or worsen anxiety. According to one study in 2010, trusted source, people with panic disorder and social anxiety disorder are especially sensitive to the anxiety-inducing effects of caffeine. Skipping meals. When you do not eat, your blood sugar may drop, and that can lead to jittery hands and a rumbling tummy, and it can also trigger anxiety. Financial concerns. The 6th point. Worries about saving money or having debt can trigger anxiety. Unexpected bills or money fears are triggers too. Parties are social events. If a room full of strangers doesn't sound like fun, you are not alone. Events that require you to make small talk or interact with people you don't know can trigger feelings of anxiety, which may be diagnosed as social disorder. Conflict. Relationship problems, arguments, disagreements, those conflicts can all trigger of worsen anxiety. If conflict particularly triggers you, you may need to learn conflict resolution strategies. Stress. Number 9. Daily stresses like traffic jams or missing your train, late for meetings can cause anyone anxiety. But long-term or chronic stress can lead to long-term anxiety and worsening symptoms as well as other health problems. Stress can also lead to behaviors like skipping meals, drinking alcohol, or not getting enough sleep. These factors can trigger or worsen anxiety too. Public events or performances. Public speaking, talking in front of your boss, performing in a competition, or even just reading aloud is a common trigger of anxiety. What can be the personal triggers? The triggers may be difficult to identify. These may begin with a smell, a place, or even a song. Personal triggers remind you, either consciously or consciously, of a bad memory of traumatic event in your life. If you can identify and understand your triggers, you can work to avoid them and to cope. You can learn specific coping strategies to handle the triggers when they happen. Now, what are the symptoms of anxiety? The most common symptoms of anxiety include uncontrollable worry, fear, muscle tension, a fast heartbeat, difficulty sleeping or insomnia, difficulty concentrating, physical discomfort, tingling, restlessness, sweaty palms, feeling on edge, irritability, start to sweat, back pain, headache, stomachache, diarrhea or vomiting, stammering. You can also experience negative self-talk. You can hardly sit still. Feel like something bad will happen. You want to be alone. You delay things. You lose self-confidence. You stop eating, but you still gain weight. You become hyper on simple things, worrying about your past events. Occasional anxiety is common, but chronic feelings of worry, fear, or dread are not. They are a sign you should seek professional help. Now, so what are the possible coping strategies to manage your anxiety? There are a range of strategies you can try to manage your anxiety. What works is different for everyone, and it can take time to find the strategies that work best for you. But remember, if your anxiety is proving difficult to manage, seek support from a professional. Some common strategies which can help in managing anxiety are: accept that you have anxiety. Take a break from technology. Challenge your thoughts. try doing some yoga. Practice some deep breathing. Focus on the present moment. Count to 10 slowly. Practice some mindfulness. Take a break. Slow down what you are doing. Try singing. Learn what your triggers are. Learn to play any instrument. Distract yourself. Get plenty of sleep. Come up with alternative thoughts. Join an exercise group. Exercising or stay fit. Try engaging in ratio breathing. Don't be afraid to ask for help or talk to someone about your anxiety. Explore solutions to overcome your worries. Visualize a safe place. Practice self-care. Read books. Listen to calm music. Get fresh air. Clean your lungs. Limit the amount of caffeine you take. Have a relaxing bath. Build or join a mental health support network if needed. Journal your worries. Understand when you start to melt down. Try to keep things in your perspective. Learn some progressive muscle relaxation techniques. Make sure you are eating a balanced diet. Limit the amount of alcohol you take. If someone is experiencing anxiety that is becoming disruptive and coping strategies are not working, they should seek professional help. That time, it becomes an anxiety disorder. It is normal for someone to experience anxiety in response to stressful events and situations. There are several ways to deal with anxiety, including quick techniques to calm anxious thoughts and feelings. Long-term coping mechanism might include maintaining a healthful lifestyle. People who experience regular anxiety might require treatment. Although everyone experiences normal anxiety in certain situations, most people, even those who experience traumatic situations, do not develop anxiety disorders. And people who develop anxiety disorders can get relief with proper treatment and care. They can learn ways to manage anxiety and to feel more relaxed and at peace. Thank you to those who subscribed our channel and has become part of SIEA members. With your support, we are motivated to make more of these educational videos, and this video gave you a good overview about anxiety and its symptoms and how can you cope with any type of anxiety until it goes extreme. Now, if you like this video, please share, like and subscribe. Thank you very much.